You can also book a mental health professional on our platform, talk to a therapist one on one. We also have the wellness goal tracker. So if you want to achieve a particular thing as far as mental health is concerned or whatsoever, you can use our platform for that. And going to the unemployment part, is and what we're doing is we are collaborating with organizations who need certain skills. So as far as unemployment, because unemployment is a very big issue as far as mental health is concerned. So many young people graduate from universities, 2 to 3, 4, 5, 6 years, they don't have a job. So what we're doing is people with that certain type of condition in that section, we collaborate with young with organizations that will be interested in hiring, and not just organizations that help hiring, we also collaborate with organizations that teach certain skills, because some people just come out of university without skills and look for a job. So we collaborate with organizations that teach skills, then also get jobs for you.
Hello and welcome to another episode of the Africa Written podcast. I am your host, Nontabego Mlambo. As we mark Mental Health Month this May, we are exploring the intersection of technology, innovation, and mental wellness across Africa. Today's conversation is with Ridwan Oyenuga, an artificial intelligence specialist and full-stack software engineer with over 6 years of experience building intelligent systems and scalable digital products. He is the founder of SereniMind, a powerful mental health platform that has already impacted more than 300,000 people across the continent. Recognized by institutions including Harvard University for using technology to solve real-world challenges, Ridwan has also led youth programming and mentorship initiatives through the African Union, the Federal Ministry of Youth Development, and the Google Developer Group. In this episode, we unpack how artificial intelligence can help bridge gaps in mental health care, the importance of accessible and stigma-free support systems, and how platforms like SereniMind are creating safe spaces for healing, connection, and community across Africa. Thank you so much, Ridwan, for joining me today. Could you just please tell me who you are and the work that you do?
All right, thank you very much for having me. My name is Ridwan Oyenuga. I am a Nigerian tech entrepreneur and a youth leader, and I'm also a mental health advocate. I'm the founder and CEO of SereniMind, a mental health tech startup. We focus on expanding access of mental health across Africa. So basically, my work sits more of intersection between technology, youth development, and also social impact. Thank you.
Okay, let's start with the story behind Serene in Mind. What inspired you to start this initiative?
All right. As for my inspiration for Serene Mind, I would divide it into two things specifically. So, observing people around me experience one or two mental health challenges, and personally myself, I had this issue of social impact. Up until now, that I'm just trying to build myself. Earlier on, I had this social impact thing, social anxiety. Sorry, social anxiety. So it's something that I had deep in me, and also had friends who were going through depression, some self harm, and all basically. And I saw the fact that I had these skills, technological skills, and I could solve a problem for at least myself and my friends. So it was more of a solution that started for I and my friends, and I realized that millions and millions of people are actually going through mental health challenges. It's not just I or my friends, and that's basically how Serenity Mind started.
You just said you yourself, you were feeling like you were struggling with social anxiety. And we know right now a lot of young people are facing pressures from school, from navigating unemployment, and many other social media as well, and many other challenges. What are the most common mental health challenges that you see young people facing today, especially where you work and the ones that you help in your organization? What are some of these common challenges that you've seen?
Okay, so social anxiety is one which is very, very important. Not necessarily social anxiety, but we see anxiety, depression, and low self esteem being something very serious. When I say low self esteem, we see people who, for example, you could be scrolling through Instagram and you see your age mate or something living this frivolous life or something. So that's where low self-esteem comes up, and what people feel they are not gotten to a certain position yet, and that could cause anxiety, and worst case could also cause depression, especially in Africa, where we believe spiritual, everything is spiritual. So if you're not progressing in life, then it's something spiritual. Somebody is probably attacking you or something. So yeah, it boils down to anxiety, low self-esteem, and also depression for young people of nowadays.
I saw on your website that you use storytelling. How do you use it to address issues around stigma, and how do you use it to normalize conversations around mental health?
Storytelling is actually one of the most powerful tools for changing culture. Fact and statistics are very important, but stories are what people actually connect with, especially emotionally. So when someone hears another person sharing a genuine experience about struggling with either anxiety, burnout, or depression, it more of helps them to realize that they are not alone. And through one of the initiatives that we ran in February called the Africa Wellness Voice Initiative campaign, we focused heavily on youth led storytelling. So, young people from different African countries share their perspectives, their experience, and reflections on mental health through digital platforms. And what makes it very powerful is that the voice comes from peers rather than coming from institutions directly. So when young people see people like themselves open up, speak freely, it reduces the issues of talking and makes you want to open up more. So when it comes to storytelling, the goal is not just to create awareness, it's to normalize talking about how you feel. And when mental health is a conversation, definitely would have better mental health across Africa with young people.
Another thing that you talk about in your website is the economic and social impact of mental health. What are the economic and social impacts of mental health challenges?
All right. So, one thing we need to understand is that mental health is not only a health issue; it is also an economic and development issue at the same time. So, when people struggle with untreated mental health challenges, it definitely affects productivity. It affects education outcome. It also affects workplace performance and the overall quality of life. So, students dealing with severe stress or depression may struggle academically. Employees experiencing burnout or anxiety may find it difficult to perform at their best. See entrepreneurs facing extreme pressure, and this may cause the downfall of their venture. I believe statistics says uh, about 70% of entrepreneurs in the first year go through either depression or anxiety. So this is definitely affecting the economic progress. And also on the national level, this translates into loss of productivity and economic cost. So globally, mental health conditions are estimated to cost over $1 trillion every year due to productivity and healthcare costs. So basically, this is the amount of money that is being spent, that is being lost as far as mental health is concerned, trillions of dollars every single year. So there are also social impacts, and mental health challenges can affect relationships. It can affect family stability and also communities at the same time. So yeah, if we try to see how we can address this also on national economic level, definitely will strengthen our overall stability and resilience on mental health.
Could you please just paint a picture of how it looks like? So I feel very stressed and I'm unemployed. I feel the weight over my shoulder, and then I contact you. How does it look like? What is the first step? What do you do to help me get to a point where I feel like, okay, now I'm breathing, I can breathe?
All right. So on our platform, we have various features. That's one thing. And I'll address the unemployment part. So on our platform, we have various features. We have the AI, we call it Sereni AI. Basically, it's more like an AI. We can look at ChatGPT, but specifically for mental health. Basically, it helps you in your mental health journey, and this is free on our platform. So I used it myself. I'm very honest. I used the AI myself. Sometimes when I just want to think about some certain things and just go to the AI, prompt it myself, and get some things. We have that. We also have what we call the mood centric activity. And the mood
Okay.
centric activity is a very, very important feature that we have on our platform. Why? Because we realize that young people don't necessarily like talking to people. Rather, most young people nowadays love watching movies. Some love reading books, some love music, some are deep into exercises, and some love playing games. So what we did was that based off of your mood, depression, anxiety, whatsoever it is, it recommends movies for you to watch, games for you to play, activities for you to do, exercises, music to listen to, basically activities for you based off of your mood. So that is something that we also provide. And trust me, this has helped hundreds, if not thousands, of people across Africa already. And we also have a community platform. And what we do in the community is basically it's more like an anonymous community. So you can come there, talk about how you feel, talk about things that currently are going through your mind and all. And there's always someone there to ensure that your response or your questions or whatsoever is being answered. You can also book a mental health professional on our platform, talk to a therapist one on one. You can also use a journaling session. So the journaling tool, basically you could journal about anything, how your day and every single thing. We also have the wellness goal tracker. So if you want to achieve a particular thing as far as mental health is concerned or whatsoever, you can use our platform for that. And going to the unemployment part. So what we are trying to do now is, and what we are doing is, we are collaborating with organizations who need certain skills. So as far as unemployment, because unemployment is a very big issue as far as mental health is concerned. So many young people graduate from universities, 2 to 3, 4, 5, 6 years, they don't have a job. So what we're doing is, people with that certain type of condition in that section, we collaborate with young with organizations that will be interested in hiring, and not just organizations that help with hiring, also collaborate with organizations that teach certain skills, because some people just come out of universities without skills and look for jobs. So we collaborate with organizations that teach skills, then also get jobs for you. Because definitely, I believe once you can solve that part, it's definitely a milestone for whosoever is going through that particular challenge as far as mental health is concerned.
There have been many initiatives on mental health, and what makes this one different from the traditional mental health awareness campaigns?
Different things. First of all, we look at the traditional mental health. So, traditional mental health awareness campaign, they mainly focus on information dissemination, such as the posters, the seminars, the occasional awareness. While those efforts are very, very important, which I concur with, we also believe that there is need to go deeper. So, SereniMind, we combine technology, we combine community engagement, and we are very strict on youth participation. So instead of telling people about mental health, we created a platform where they can access and continuously learn and engage in conversations. Another key difference is scale. Using digital platforms, we can reach young people across every African country. If not all, at least 90% of African countries, we can reach them through digital platforms nowadays, rather than just being limited to a physical location. And like I said earlier, what specifically on our campaign was that it was natural. You see most people working on campaigns and they spend millions and millions and millions of dollars just so they reach hundreds of people. We didn't spend a dime, and our impact spread across 100 million people across Africa. So this is genuinity. When you do things with genuinity, definitely it's reach the right people when it's meant to reach them.
What are some of the small habits young people can adopt to protect or improve their mental well-being?
And regarding that, mental health often comes from small habit consistency. That's something you need to understand. You don't need to do something so big. You don't need to have that big action. So one important habit is to learn to pause and check yourself. So basically, take a few minutes each day to reflect on how you are feeling, and how you are feeling can help you become more aware of your mental state yourself. Another habit which is very important is setting healthy boundaries with technology and social media. So constant digital exposure can be so overwhelming. So it creates moments of digital rest. It's very, very important. We need to stay away from social media in as much as we need to also be on social media for various things and technology, because what we're using now is technology. So there should definitely be time for tech. There should be time staying away from that. And also physical activities is very, very important. Even simple walking, stretching, or light exercises can significantly improve your mood. And one thing I would say that people don't really see is eating well. To be honest, as for me, most times when I'm not in the right mood, I just eat a lot, and it just puts you back in your normal mood. You just eat, watch Netflix or YouTube or whatsoever it could be. Just go away from people. You don't have to go away from technology, because definitely you are gonna watch Netflix or something. Just go away from people. Spend time eating. Spend a lot of time eating. Eating helps a lot, and I'm a testimony of that.
What are some of the challenges that you faced since starting this initiative?
All right, so different challenges. First of all, financing is one of it. Financing this is has been a challenge, but we try to manage it as much as we can. Uh, Part of our goals is also to reduce the amount we spend, and also reduce the amount that people also spend while using our platforms, while trying to engage in our platforms. That's also the goal. Because we look at Africa, we don't have so much resources wise, and most people who are going through these mental health challenges don't also have so much resources. So that has definitely been a challenge. You spoke about internet issues. Definitely, sometimes while going through therapy previously, we used to have internet challenges. But one way we've come to solve that is by developing our own system where you can more of have your conversation with the clients or with the patients with less bandwidth, so it doesn't take so much data as it should be taken. So that's that. Another challenge which is out of what you said was probably managing your team. So, and this is definitely for every founder out there. You have a team, you have to ensure that you are managing the team the right way. Trust me, you can have 10 people in a team and four could be slacking out. So it's up to you to bring them back and just make sure they're in the right direction. And also, breaking out is it happens a lot. So I know so many times where I'll be so stressed. I'll be so stressed. And I'll just leave SereniMind for a few days. Like I've done that now. Trust me, this is the first activity I'm doing as far as SereniMind is concerned for the past few days now. Because sometimes the work is just a lot. And you have to just step back, reflect on what you've done, and just go back to making the impact you make.
Yeah, you can be helping other people when you yourself are not feeling well. So it's a good thing that you take time off and sort yourself out before you can start pouring into other people. If we have this conversation again in 5 years, what impact do you hope Sudden in Mind will have made in the continent?
All right, in 5 years, I hope SereniMind would have helped transform how mental health support is being accessed in Africa. One, two, I also envision a future where millions of young people can easily access mental health education, also digital support tools, and professional services using technology. I also hope that SereniMind would have helped build one of the largest youth-driven mental health communities on the continent. Even currently, we are the largest youth-led mental health organization in Africa, but we can do more. Not just youth-led, we can expand. Not even in Africa alone, going globally at the same time, and also where young people can support each other, share their experiences, and advocate for better mental health. And one very important thing that I would also love is to strengthen collaborations with governments, universities, and international organizations so that mental health becomes integrated into public policy and youth development programs across the continent.
Thank you so much for taking time to talk to me. about this important initiative. And I wish you all the best with your organization.
Thank you very much.
That brings us to the end of today's episode with Ridwan Oyenuga. This conversation reminds us that mental health support can take many forms and that innovation and technology have the potential to make care more accessible, inclusive, and responsive to the realities many across Africa face. From AI-powered chatbots and mood tracking tools to access to licensed professionals and anonymous support communities, SereniMind is part of a growing movement reimagining how mental health and mental well-being support can reach more people, especially young Africans navigating stress, uncertainty, and stigma. As we continue observing Mental Health Month, may this conversation encourage more openness, empathy, and action around mental wellness in our homes, workspaces, and community. Thank you for listening to the Africa Within podcast. Don't forget to subscribe, and if you found this episode informative, please share it with a friend. See you next time. Bye.